How's it going, everybody? Welcome to another New Biology Clinic video. We're just going to be touching on something that I'm going to be diving much deeper into next week for a webinar for the members at the clinic. And we're going to be talking all things heart attack and stroke and just trying to look at it from a different lens. And one of those lenses that doesn't necessarily get brought up, or at least I haven't been seeing it in relationship to heart attacks and strokes, is the fascial system. Now, many of you might be now familiar or aware of what the fascia is, its role in everything, or at least starting to recognize it has a much greater role than once told and believed by many quote unquote professionals. But one thing that I have found really interesting and fascinating as I've been putting together this webinar, doing more research, is just how closely related fascia is to our heart and our uh, our spine, sorry, our spine and the cerebral spinal fluid. And what I mean by that is there is stuff out, research out there to show that there is fascia within the cerebral spinal fluid, not just around it, but within it. And if that is the case, and that is true, the first question I have is why? And if you then take that same question and recognize that it's also surrounding and very much interconnected within the heart, then the next question I have for that is why? Why is there fascia around these points, these critical pieces to our life? And then the question I also have is, of all the parts of our body that have these severe reactions or anything related to fascia, you never really hear like, oh, I had a leg attack, or I had a shoulder attack, or I had an abdomen attack. When you have these cramp, like a cramp, for example, or like a muscle cramp. But when you have a genuine cramp of the heart, it's called a heart attack. And we could say, well, it's because the arteries are blocked or the everything's blocked. Well, if you look more into that, and Tom does a really good job at diving into this as well recently in one of his webinars, he shows without a shadow of a doubt that blocked arteries can also have other pathways for blood to flow through the heart. There's more than one way for it to go through the heart. And they can show that through different scanning and different technologies that the heart will still flow, and that people with 50% blockages, 80% blockages, 40% blockages, they're not all having heart attacks at the exact same time. And that is an interesting piece of it, is going, so someone who has an 80% blockage who's completely fine, relatively speaking, they're not having a heart attack, but they have this massive blockage and they're not having a quote unquote heart attack. Yet somebody who has a 40% blockage is having a life-threatening heart attack or heart attacks. And the question is, well, why is that? If it's about the blocking of that artery or the blocking of whatever, there should be a consistency, and there isn't. So if that's the case, is the blockage really the cause of the quote unquote heart attack? And so what we're going to try to do in this webinar is try to connect some dots here, start to make sense of this. Because if you also look at the spinal column, the cerebral spinal fluid, and strokes, a lot of times there's blockages within the brain, and people have blockages and they're completely fine. They can live their life. There's people who have minor blockages and it causes a stroke. It's the same thing with the heart as it is with the cerebral spinal fluid. So the question I have is, well, what could be causing that then? Is there something else? I'm not saying that doesn't play a role, but are there other pieces that are quote unquote putting the nail in the coffin? And that's where we have to dive into. If we really want to try to look past what we think we know and start asking questions that maybe seem outlandish or out there in some way, this is how we can start really getting better at fully not just understanding the body in general, but understanding what our body's communicating to us individually. And that's my goal with all of this, is can we be more in tune with our own body and recognizing the communications and the conversations truthfully that the body is trying to give you, trying to give us. So if we can recognize that fascia does play a role in all this, we're, in my opinion, starting to get to somewhere a little bit more past just mainstream individual, we all know this type of mindset. It's starting to get a little creative in recognizing the body is very creative with how it's going to express its needs to us. So anyway, I'm excited to share this one. I'm excited to dive into it. But I really hope this gets you thinking. If you know anyone who's had a heart attack, if you know anyone who's had a stroke, the first question I'm going to ask you or anyone listening is not just their lack of movement, not just their lack of certain diet habits, but what is their stress level like? How do they handle stress? Do they hold on to stress? Do they communicate their problems? Do they have a space or people to talk to with their problems? Do they tend to, when they are moving, for example, exercising, are they trying to work out to forget something or to numb a pain, or are they working out with an intention? Because I get a lot of people who tell me that they know someone who was really healthy or they were really healthy, they had a stroke and a heart attack, or know somebody who had a stroke or a heart attack, and they were super, super healthy. The first question I tend to always have is, well, what was their internal state? What was their mind like? What was their stresses? Did you know? And so, and not to make this into the dark side of things, but we have to start, in order to fully understand what's going on, we have to recognize it's not just exercise and eating well, because you can still exercise and eat, and your intentions, your mindset can really jeopardize those two components. And what happens in those moments? Now your body reacts. It might tense up. What causes a lot of tensing? It's the fascial system. So anyway, that's a little teaser. I look forward to seeing you at newbiologyclinic.com. I hope you all have a wonderful day. And until next time, I bid you adieu.